Again, my name is Chris Lopez. I'm the Director of Development at Grassroots. It's always my pleasure to be able to introduce new partners, schools, but this is a new and interesting partnership. It's a partner between two very powerful and very interesting groups, My Benefit Advisor and Kerber. The services that they're providing to you are insurance and benefits and legal aspects of things. Because if you're a nonprofit, a small nonprofit, as is Grassroots, we're a team of 6 individuals who actually run all of this stuff. And some days I'm actually pretty impressed with who we are and everything that we get accomplished on our own. But our focus isn't always around what are the laws and what are the legalities and how do we manage this and how do we manage that. And we don't actually have a dedicated human resource person. So when we came across this opportunity, we were like, oh my goodness, this is fantastic for us and something that would probably really benefit our members who are out there trying to raise funds and trying to help people on a daily basis. So we wanted to bring this opportunity to you guys, and we're so happy to have Elizabeth, Sharon, and Duane on the line with you to give you a high-level overview of what it is that this product provides for you. Before I do that, Duane wanted me to pose a question to you because we want this to be as interactive as possible. It will be a brief presentation. Hopefully you'll be as excited about the product and offering it as we are. It is a free product. This is one of the things that we did forget to mention in the last webinar, so I wanted to throw that out there really quickly. Duane wanted me to ask you, what is the most important asset to a nonprofit? And you can go ahead and drop your answers into the chat window. The first 3 people to answer correctly will receive a $50 Amazon reward card, and at the end of the session, we'll identify who that is, and we'll have to go ahead and get your Amazon code so we can get that out to you. So that's a really quick intro. We're very, very excited about this partnership. We feel that it will provide you as a nonprofit a lot of benefits. And with that, let me hand this over and introduce you to Sharon Ross. Sharon?
Hello. You can hear me okay, Chris?
We can. Yeah.
Okay, great. Hello all, my name is Sharon Ross and I represent My Benefit Advisor. And I want to thank you all for coming on to this webinar today. Elizabeth, go ahead, and Elizabeth will be working the slides for me. So I'm going to have her just switch to the next slide. Thank you. What is My Benefit Advisor? Well, we are a platform that guides employers through the complexity of managing an employee benefits program. And some of the services that we include is we have a full advisory team, we have healthcare reform consulting, we have a proactive management, we have analysis, open enrollment, and compliance assistance. Our history, we are a sister company to a general agency out of New York called Emerson Reed, and we are the sister company of that. And through in 2006, we started My Benefit Advisor because we felt the need of offering some of the programs that we offer, how we take care of employers, and some of the technologies that we could offer to those employers. We start with an advisory team, and there's 7 different people that are involved with you when you are a part of My Benefit Advisor. The first is the advisor. That would be Kerber. I am Sharon Ross. I'm your account executive here. And then there's Teresa Danzelli, who's out of the New York office. We have an account manager named Christina Rodriguez. We have an implementation specialist, who's Lisa, a benefits counsel person, which is Pamela, who is continuously monitoring all of the changes coming through with the new healthcare law. We have an ancillary specialist. What's ancillary? Well, that's someone that we can put together dental, vision, life products for you, for your employees. as part of an employee benefits program. And then we have a technology specialist, and we're utilizing Elizabeth Aguirre, and she's going to be presenting later on some of the technologies that we offer. Our approach, we have 4 categories that we look at when we're managing an employee benefits program. The one is consulting that we start with, and that is basically looking at the benefits that you currently offer your employees. We do the quoting of those benefits, make sure that, or we go to market, we go to other carriers to look at what else is out there. What are the costs and what are the plan designs? What's available to you when putting together an employee benefits program? So once we get the quotes back, we analyze it, and we work with you on coming up with a good solution for you and your employees. Then there's the enrollment process. And the enrollment process, we're going to be communicating, of course, with you throughout the enrollment process, communicating with employees. We're going to be collecting the paperwork. We're going to be going to the carrier. We're going to make sure that everything goes smoothly. We're going to assist in provider networks if you have questions on provider networks and getting the employees set up on the program. We have a compliance section, and this is where we are keeping you, the employer, up to date on all of the changes on the healthcare law, and we're going to be talking more about that further on in the presentation. And then we have the management of your employee benefits program, and this is the servicing. This is when you have a dedicated account manager, and that is going to be Christina Rodriguez. That's going to be assisting you on all of the servicing so that you're not spending all the time contacting the carrier. You're just going to contact one person, and she'll take care of the rest. Healthcare reform consulting. With the Affordable Care Act, which is our new law, there are a lot of changes coming down. Some changes impact an employer depending on the size of that employer. We are going to be keeping you up to date on any legislative changes depending on the size of your company and how that's going to impact you. And we're going to guide you through that. So that's where we come in very strongly when it comes to healthcare reform consulting and the healthcare law. We're very well versed on all aspects of that. You also have, once your employee benefits program is in place, go ahead, Elizabeth. If we can switch to the next slide. There we go. The employee hotline is available. Once you have your employee benefits in place, we do offer an employee, each employee, we give them a card where they can call into us for the first 30 days of their, once the enrollment has gone through. They have complete access to Christina and answer any questions. We offer this for groups that are 10 or more, primarily because we find those are the groups that are going to actually use that kind of service. But know that any kind of questions that any employees may have about their employee benefits programs, they're always going to have that link either through you to Christina or directly to Christina. And we can answer questions anywhere from getting a primary care physician or how deductibles work, co-insurance, just so that they have a deep understanding of what they are actually getting with their benefits. The benefits management is our servicing area. This is where you have that dedicated account manager, which is Christina Rodriguez. Again, she's going to assist you in the claims support, general questions on your policy and the procedures and the billing inquiries, the transaction processing, whether you have a new hire and there's paperwork that needs to be submitted for them for their employee benefits, communicating that to the employee on how the program works. If you have a term, if someone is leaving the company, we need to get that information over to Christina so she can take care of that for you. Very proactive in communication. She's reaching out to you. We also have email blasts and monthly newsletters to keep you up to date on what's going on within the healthcare system And then we have a 12-month service calendar. So we start our renewal process 6 months prior, where what we have found is they notify you 3 months before. We want to notify you 6 months before to collect information to get ready for your open enrollment when it comes to updating your census and some of the changes that are going on. So we keep you up to date, and we're constantly in communication with you throughout the year. Cobra Administration, we assist you in Cobra. Usually that's done where it's 20 and above for Cobra Administration. The carrier usually takes care of that. However, we want you to notify us, of course, because if there's a termination, we need to notify the carrier to be sure that you have all that employee or ex-employee actually gets all of the paperwork for Cobra. So we keep you compliant with Cobra as well. Then we have the compliance assistance, and this is where this all stems around our new healthcare reform, our new healthcare law. We have a benefits council that is monitoring all of the healthcare reform changes. We in turn put together bulletins, and we are sending them to you as our clients, keeping you up to date, what's happening, also consulting with you if it happens to whatever's coming through legislation, if it impacts your group in any way. Because remember that depending on the size, how many employees you have, it gets more complicated the larger you are. And we want to be sure that we're there for you, where we're constantly in communication with you when it comes to compliance and keeping you compliant. And at this point, I'm going to turn this over to Elizabeth so that she can go through some of the technology that we can offer you.
Thank you so much, Sharon. I'm sorry about that. I was having trouble unmuting myself.
I was getting worried.
Well, my name is Elizabeth, and I work with Seamus. We are the technology specialist for My Benefit Advisor with Kerber Goss. And so what that means is my job is I have a really fun job. I get to demo some of our resources and our tools that you can take advantage of. So like Sharon was mentioning, we email out the compliance bulletins on a regular basis. Well, we know that you're busy, you probably receive a ton of emails, so we make them available in other places as well. So resource and tool, I guess, I want to show you, which is available to any client that partners with us, giving us their employee benefits business, is our Compliance Education Center. So our Compliance Education Center, it has is basically a hub that contains all those compliance bulletins that we've emailed out. Typically during a month, we send out 2 to 4. So depending on what's happening legislatively or throughout the marketplace is how many bulletins are sent out, but typically they're about 2 to 4. And we make them in easy to understand language. So we put them in employer or language so that way you can easily read them and digest the information. And if I tend to click on here, I already have it open in this window. So this is one of the bulletins. Sorry, hopefully I'm not making you sick scrolling here, but this is one of the latest bulletins, Medicare Part D. So it's just an example of what we're distributing to you. So we put a little background about the notice to participants, what you need to do, links to the cms.gov website, so you don't have to search on their website and spend, countless minutes, sometimes maybe even an hour, trying to find the right place that houses the document that you need. So we provide links when applicable, and just like important topics that you need to know regarding that. So how it affects you and what you need to do. I know that sometimes, we're so busy and we're reading so much information. You can read a compliance bulletin that comes out and you finish reading, you're like, I need to read that another 2 or 3 times. You don't quite gather all that information. So we understand that, especially you in the nonprofit industry, you guys wear a ton of hats. So for any of the directors, or if you are lucky enough to have an HR administrator, they can utilize this and not only read the bulletin, but we also provide little videos, little Brainshark videos. If you click here, it opens up a Brainshark video. So this is the one on Medicare Part D. And I'll just play you a quick sample. So basically, it's not someone regurgitating or just reading the bulletin, but they're putting it in little snapshot ideas, so little bullet points of what this means to you, what do you need to do as an employer, and how does this affect you. So that way it's easier for you to understand. So whether you have time to read a bulletin or you want to read it and then watch the video, or however you take your information and are able to understand it, we want to provide those tools for you to help you in your business. So let me play a little snippet here. I'm going to put my phone by the speaker.
Reminder to distribute creditable coverage notice. Who and when? Employers who sponsor a group health plan with prescription drug benefits are required to notify their Medicare-eligible employees and dependents. The notice must be provided by October 15th of 2015, and both creditable and non-creditable notice links are included in this bulletin. The notices are also available in Spanish. Why send the notice? Thank you for listening.
So that's just a basic idea of what these Brainshark videos are about. And at the very end, the last slide says, thank you for joining us. Please contact us with any questions you may have. So after watching the video or reading the bulletin, if you have any questions, you're free to contact your account manager to help you clarify that information. So again, we have all the latest bulletins here in our Compliance Education Center, and you can sort them by date, by month, and take a look at them. So if you have extra time, let's say on a Friday or whatever your slow day is, you can take a look at the last updates and kind of keep yourself up to date on the latest topics that have come out. The next resource we have available to you is what we call the client portal. So our client portal is available to all our clients. So whether you're the director of your company or the HR human resource person, you can have access to this, and we'll provide you with your own username and login. And we house again the compliance bulletins here on the right. You'll see, and that's because the number of times you see them, the more likely you are to read them. And we know they're important. We want to get those in your hands. On the left, you'll see that we have a self-help compliance tool video. We'll always have a question of the day and the latest healthcare reform information in the news. I'm going to keep this really high level just to save time, but we also have a tab here for plan information. So all your current plan information or prior plan information is housed here. So whether it's group dental or medical, you always have access to this wherever you are. So you can treat this kind of like an intranet. So anywhere you go where there's web access, you can log on and have all this information at your fingertips. So you don't have to log into different systems to find all this information. It's all in one spot. We also have HR compliance information here as well. So whether you're looking for websites on the state regulators, the most recent some compliance forms that are important to you, or you can use the scroll bar here and say you have a question regarding Cobra. You can click on Cobra, and all the definitions of Cobra are listed here. We have a tab for administration, how to administer Cobra, and different notification requirements. And we have those types of information available to you depending on the topic here, FMLA, HIPAA, Medicare Part D, Section 125. We also have a community section, which is kind of like LinkedIn except without all the ads. So this is across industries, across the nation. You can post any question you might have, and other HR administrators or business owners will answer. They also have surveys on here where you can get a chance to win a gift card for answering. We also keep the most important links that we find our employers are utilizing here on the link library. So whether it's benefit plans, human resources, healthcare, links we think that you might utilize, we have available here. And then we have a document section. So not only are the compliance bulletins listed here, but say you need maybe your employee handbook or different information readily available on the internet. Anytime you log into this website, you can upload that information, and then wherever you are, you can have it easily accessible to you. So this is for, again, business owners, directors, HR administrators to utilize. And then the last but definitely not least tool I wanted to demo for you today is our ThinkHR Comply website. So this is for those groups that have 10 or more employees, just because you know, if you get smaller than that, a lot of times we know it's not utilized, so we keep it for 10 or more employees. But it's just a wealth of information. So this is a library that it basically houses all the information for human resources that you could want. So whether it's wages and hours, discrimination, staffing, it also provides many resources along the top here and tools that are available. There's a search bar, so instead of going on to Google or Bing or whatever your search engine preference is, you can come on to ThinkHR and type in a question, and it has intelligent search, so it's intelligent in two ways. So let's say you're looking for something with FMLA, not only will it help you find that answer, but as well the most clicked on article will populate to the top. Of course, and I want to show you, it's not going to do that, but if I press enter here, so all the search results for FMLA will populate, and you can see on the left how they're labeled. So if you want a checklist maybe or a tool, you can click on that and it filters that way. And if there are, there's also the ability to sort by state, so whether in California or New York, you can get specific information that applies to your state. And the search bar follows you wherever you go throughout the system. And if this is a tool that you do have access to and you need a more in-depth overview, of course, that's something that we can provide for you as well. But some of the popular tools that they have here for you is a question and answer database. So ThinkHR actually started as a question and answer company. So they house a ton of different questions and answers that owners and HR administrators and directors have asked throughout the years. So if you have a question, the odds are someone else already had that question and it's been answered and it's available in the database here. They also just updated their employee handbook builder, which is awesome. Every company needs an employee handbook, and it takes you through a step-by-step process of building one. And I'll just click here so you can kind of see how it starts. But the new update, which they just came out with, is it's now available with specific information according to your state. So you can see the different sections here. So you can make them state-specific because each of the states, have different rules as far as what they need in them. So instead of having a ton of billable hours to maybe your employer employment lawyer, you can create the handbook and give it to them just for review, and it'll save you a lot of not only money but time as well, because it takes you through the process here. There's classification tools, compensation tools, and a great place if you have extra time, which you probably, you're like, extra time? There is no extra time. But they do have a white paper library on here, which has a great source of information here as well. So a really great white paper to read is the timeline of benefit notices for group health plans, and this is their latest one. So it has the timeline of when you need to send out notices as far as employee benefit notices. So whether it's a HIPAA notice or a Cobra notice, when you need to be sending those out. So they have a lot of great white papers here available. And then I'll just show you the bottom here. All the popular topics are listed here. And then at the bottom, the latest HR news is available here. So if you need to see what's going on currently. Also, the most recent questions and answers. You can see what other people are asking currently and if it applies to you. You can see the latest alerts according to state. And the policies and forms can also, there's some of them that can be found here at the bottom. So not only can you search for them, but you can come here at the bottom and find, some of the most used policies and forms. So you're not creating a policy from scratch, but you can come here and use a sample one and just customize it for your agency. So that's a lot of information, a lot of great resources we have here available to you. And that is it from me. So I'm going to turn it over to Duane from Kerber.
Welcome. This is Duane Kerber, Kerber Gost. My name is on the title of this. I've been a insurance broker now for almost 30 years at the national level, and today still at my private company level. In the last, since 2005, I've concentrated solely on the nonprofit community. I've made it my mission to essentially enhance all of your abilities as best as I can with knowledge and information that I possess within the world of insurance and finance. One of the things I want to start out with here today is I'm going to speak specifically to the Affordable Care Act and the Affordable Care Act rebate that is available to the nonprofit community. I want to start out with a quote here by Abraham Maslow, one of my favorite quotes. It says, "One can choose to go back towards safety or forward toward growth. Growth must be chosen again and again. Fear must be overcome again and again." That really hits home and hits me right where it counts in the heart, because the last 2 or 3 years as I traveled talking to the nonprofit community, I saw the frustration as it came across from the side of, what are we going to do with our health benefits? The costs are rising significantly. We're losing benefit. All these things that create anxiety and fear and frustration. And I was as frustrated as all of you, because I am also a consumer. It was difficult to understand, is the law going to stand? Is the law not going to stand? All these things were happening. Today, if we fast forward from 2010, the law is the law, and the Affordable Care Act is going to guide us through our next several decades of health insurance. So inside this law, which was really unique, because I kept getting the same question over going, Duane, you've got to save us some money. Duane, you've got to help us. I knew I couldn't save you any money. The cost of operations are controlled by the insurance world, and that cost has not gone down. Think of it this way. I owned a 1973 Fiat when I went to college. I paid $2,100 for it. Today, if I had bought the Fiat that the Pope drove, I'd be paying $25,000 for it. It's not going to go down. It's just the cost of doing business. What is unique is that embedded in the law were a couple of provisions. They're difficult to work through, and that's why brokers and CPAs have chosen probably not to work through them, because it involves work, and they're comfortable, and they don't like change, and maybe they just don't like to go forward and grow. I don't know, but I find this to be unique because I've always taken that challenge. Inside this organizational piece called the Affordable Care Act, there is a portion which allows you as a 501c3 to qualify for the Affordable Care Act rebate. This is an IRS cash rebate, just like your tax return when you file it. If you're fortunate enough to get money back, you get your money back. If you're fortunate enough to pay like me, you pay. So in this act, it says you can qualify as a nonprofit with certain parameters up to 35% of the premium you paid. Example, I have a one-person group, a $3,400 a year cost of insurance. This particular program for this particular nonprofit hit all the sweet spots that were part of the act, and this nonprofit actually receives a $1,200 rebate for 2015 and a $1,200 rebate for 2016 on that particular plan. We have them as low as $1,200. We have them as high as $14,000. It's all over the board. The key is we must qualify. So what does that mean? That means we need to use the technology at our hands through MBA. We need to use the intelligence that we know that the Act asks us to deal with, and we have to apply the test to each and every nonprofit to see, first and foremost, do you qualify for the rebate? Once that's ascertained, then the next decision is, do you choose to go forward? And how do you go forward? You're not moving. Go, yes, please.
Up on the screen is the link with the original, well, with a short form, and I sent that out in the email. Members can also find that in the toolbox, and there's also a link to the employee census form there as well. So
good.
Anybody who's interested in this, in addition to calling you, because you're the man that knows everything about this.
Yeah, you're just ahead of me. You're ahead of me.
Oh, I'm sorry.
That's okay. That's okay. You're fine. Yes, this will be up on the screen for you to utilize, and the census will be there, which is the first trigger that we have to use to analyze the position. What I wanted you to know is it's not about changing your level of benefit from where you are today with a Kaiser or a Blue Shield or a CDHP or whatever insurance company you're with. It's about a trigger mechanism within the code. The code says as long as you have an Affordable Care Act compliant plan, a bronze, a silver, a gold, a platinum plan, which some of you probably have been moved to by your brokers, that's great, but you missed the trigger. The trigger is you must go into the exchange. Now, some states have exchanges. Some states only use the federal exchange. That's the key. That's the qualifier. So you either go into the federal or you go into your state exchange. In California, we have our state exchange. It qualifies you. You're in. You're done. Then, of course, the fear question comes out, well, what if the exchange goes down? Well, if the exchange goes down in the state of California, we opt back to doing what we were always doing. We just no longer qualify for the rebate, or we make the move to the federal exchange and we qualify still for 2016. But you're in no worse position other than you've qualified yourself to collect the dollars that you've earned. I estimate in today's market there's over 110,000 nonprofits in the United States that are qualified for this rebate. In California, only 250 have taken advantage. So that tells you how poor of a job we as brokers have done for you. And we're not thinking about your single and most important interest, you. What Grassroots has done for me is they've allowed me to get a national platform in front of as many people as we possibly can get in front of, and I want you, and I want to charge you with the duties of spreading this word amongst yourselves. Time is extremely short. We have a calendar that will rebate you for 2015, a calendar that will rebate you for 2016. After that, I cannot promise you anything will happen because the legislature needs to act on either extending the rebate or letting it fall apart. Who knows what will happen? All I know is I've done some very simple mathematics. There's a lot of money out there for the nonprofit community to address and keep, and I'd rather see that money in your pockets serving and doing the work that you do than sitting over here on the table at the federal side of the business and going nowhere. That's what I want you to know. I want you to grow. I want you to grow within yourselves. I think if you take a serious, honest look at what this can do for you, you will agree with me, there is tremendous merit in making the move into the exchange and collecting your money. That's it for me, folks. I hope you can answer my question. What's the most important asset that a nonprofit owns? Because I think it is an incredible asset, and I look forward to distributing. Okay? Good. Thank you all.
Thank you, Duane. We do have 3 winners, and I've got everybody's email from signing up. It's Gavin Aguinaldi, Beth Filstra, and Aaron Hedges. I will get in touch with everybody after that. If you've got questions, please feel free to drop them into the chat window. Elizabeth, Sharon, and Duane are available to answer any questions that you may have. And we've still got some time left in the session. I know that it was a lot of information. I feel that it was excellent information, and we so appreciate everybody's time. I'll give you a couple minutes for questions. Nothing for questions, huh? Yes, Gavin, yeah, you won. Sharon, any parting words?
Any parting words? Well, on the screen, what I'm seeing here on my side is the census form. You just complete that. That's the first process. And then we get all the information. We get in contact with you directly, find out what your current benefits are, and then go in, and then we start quoting within that shop, which we call the shop, for the exchange for the employers for group insurance, and we go from there. And we have a conversation with you and get you started.
All right.
And I look forward to assisting each and every one of you in your employee benefits program.
All right. Thank you all for your time. Oh, one last question. Yes, Eric. Anything about the cost? There is no cost to you. And they're actually trying to get your money back. That's what we love about this partnership. So. All right, I'm getting all of a sudden getting a lot of cost questions, but I'm glad that we are getting questions. Now, there is no cost to any of the grassroots members for this service. The benefit of MBA is that they're able to quote out different shops, as Sharon calls them. That's insurance terms. Or insurance lingo, I should say, and provide you with different options for services, which is why it's complicated. As they kind of went through the whole process, Duane was talking about some rebates and going through all of that. And in order to initiate the process, you can go to the link, which I can also post as well in the chat window as soon as I'm done talking, because I can't do both at the same time. Or find the link in your toolbox and go through the process. There is no cost to you. There is no cost to MBA. There is no cost to Cobra Goss. Would it be useful for a tiny nonprofit with 2 part-time staff, or are we too small for this? Is a question from Eric. Eric, as long as you have insurance or some type of benefits, I think that it's definitely useful to you as well. So I think that we've covered, you're welcome. I think that we've covered everybody's questions. Appreciate, again, everybody's time. There will be a survey that goes out following this. Dorothy, is it Dorothy? Oh, we're still getting questions. I love this. Maybe I'll sit for a couple minutes and have a glass of wine. Oh, sorry, it's only 2 o'clock. What's the cost for non-grassroots members? Just join grassroots, Dorothy, and then it's a piece of cake. How's that? And even doing that is free. Keep them coming. I'll stay here as long as you want to stay and answer questions. I'd rather that everybody be educated and have the answers than walk away really unsure about what's happening. How do you join grassroots? Go to grassroots.org. Oh, I forgot that our friends at Kerber Gost invited some of their friends, and we really appreciate that. So thank you to Duane and Jim and Ryan. Is MBA in all 50 states? Sharon.
We are able to assist you in all states except for Alaska and Hawaii.
Thank you.